Welcome. Let's talk about how to do Sitz bath. Sitz bath is a therapeutic soak of lower body, hips and buttocks in warm water. It is commonly used to relieve discomfort or pain in the genital, anal and perineal areas. Why Sitz bath recommended? Sitz bath recommended in case of hemorrhoids and anal fissure. It helped to relieve itching, pain and inflammation. It also recommended in postpartum recovery after childbirth, especially if there were stitches or tear. After surgery, Sitz bath promote healing after surgery like hemorrhoid surgery and cesarean. Infection or irritation. Sitz bath used in case of perineal dermatitis and urinary tract infection. How to do Sitz bath? Step by step guide. Place the Sitz bath basin over the toilet seat. If you don't have one, you can use the bathtub or large bowl. Fill the basin with warm water enough to cover your hip and buttocks when seated. The water temperature should be comfortable, around 40 degrees Celsius. Avoid water too hot as it could irritate your skin or worsen certain condition. Add about 2 tablespoons of Epsom salt or table salt or betadine solution or Dettol depending upon your disease and condition to the Sitz bath. Sit comfortably on the toilet, ensuring that the perineal area is submerged. Soak for 15 to 20 minutes. Empty and clean the basin thoroughly after use. After the soak, gently pat dry the area with a clean, soft towel. Avoid rubbing or arch towel drying as this may cause irritation. Make sure the area is completely dry to avoid any moisture buildup which could lead to infection. Benefits of Sitz bath. Relieve pain, irritation, itching and inflammation. Promote healing by increasing blood flow to the area. Sitz bath reduce swelling from hemorrhoids, episiotomies and anal fissures. It helps to relax muscle, reducing spasm and keep the area clean and free from infection. Thank you for watching.